Hi you guys, welcome back to another episode of Life with Lene. And today I'm going to be answering one of the questions that I get a lot as a nurse, and that is, how do you change your nursing specialty? If you guys have been following my journey, I have worked in quite a bit of specialties when it comes to nursing. I started off as a med-surg nurse and quickly got moved to the ICU where I really wanted to work. But during my time as an ICU nurse, I also worked as a travel nurse, and that afforded me lots of different opportunities to try out different specialties, sometimes because I wanted to, sometimes because that's where they told me to work. So I am going to talk to you guys about how I got to work in as many specialties as I have, share some of my tips and tricks for you if you are interested in changing your nursing specialty as well. When we get started in nursing, we may start in a specialty and we think that it's where we want to be, but you may not want to stay there forever. Or maybe once you start working there, you're like, I did not expect it to be like this. Where can I move next? And sometimes we tend to feel like we are stuck in our specialty when it comes to nursing. Yes, there are 55 million different options about where we could possibly go, but how do I get out of this specialty that I'm in now and make that leap to a new specialty? Well, I'm going to go over that in more detail in this video with you guys today. Now, the pandemic caused a lot of issues for us as nursing, but one of the pros that happened during the pandemic and shortly after was the fact that it's much easier for you to change your specialty. Now, back before the pandemic hit, I worked as an ICU nurse, but I worked as ICU working at a long-term care facility. And a lot of the bigger hospitals in the city that I lived in, I was living in Dallas, did not want to accept me to work in their acute care ICUs. A lot of them were not even trying to take the time of day to look at my resume. And that was very discouraging for me because I knew there was a difference between working as an LTAC ICU nurse and working as an acute care ICU nurse. And I was willing to make the jump to learn the skills that it would take to become an acute care ICU nurse, but a lot of the hospitals would not give me the time of day. So it's very discouraging as someone who has experience in another field of nursing or another skill set or specialty to have to completely start all over again. Another big issue with changing your specialty is a lot of these jobs already have like a unit that is really full, and they may not be accepting new people. And when there is maybe 1 or 2 slots that open up, sometimes they already give those jobs out via favoritism, or they hire internally. So it's very hard for you as an outsider to come into that specialty. Lastly, one of the big mindsets that have shifted over recent years when it comes to nursing is that a lot of these specialties felt like you had to be a nurse for at least 2, 3, or 4 years, and you had to have worked in med-surg prior to coming into these specialties. And I have a whole nother video I'm going to be doing on that, on whether new nurses should be working in the ICU. But when it comes to specialties like trauma and ICU, PACU is another great example. They felt like if you did not have at least 3 or 4 years of nursing under your belt, they really wouldn't even look at your resume. I've even seen some people that are ICU nurses, but they've only worked in the ICU for a year, and they may apply to a job where it's a higher level of ICU, like they're applying for CVICU or trauma or something like that, and they wouldn't even give them the time of day because they would say you don't have enough experience and time before you're able to switch to this new specialty. Now, after COVID happened, there is a huge shift in this. While there may be some hospitals and some units that are still sticklers about this, the doors really opened during the pandemic because hospitals realized we cannot really be picky because we really need people. With there becoming a nursing shortage, which I know prior to this they would advertise that there was a nursing shortage, but really that's a whole nother story. There wasn't really an actual nursing shortage. It was more so the hospitals wanted to run their units understaffed for budget reasons, obviously. But with there actually being a nursing shortage, because there was a mass increase in the demand and there was a decrease in the supply, hospitals realized that they were going to have to make some changes to what they required for every specialty, every unit, and every single job. I'll give you guys a great example. During the pandemic, I was already working as a travel nurse and I had finished my very first travel assignment. Me and my family took a month-long staycation after that assignment because we wanted to go on vacation, but you couldn't really travel a whole bunch during this time. Now, I had taken my very first travel assignment. I worked as a crisis travel nurse in an acute care ICU. And I worked 6 days a week for the entire assignment, which was a 12-week assignment that I took, okay? So I was tired. I wanted to do a staycation. We went to Phoenix, Arizona, and we absolutely fell in love with it. We had the cutest Airbnb, and we just really enjoyed the vibes of Phoenix. So I thought to myself, why don't I get a travel assignment here? Now, the hospitals that I applied to would not take me, you guys, and they were very particular about certain things. If you were to take a travel assignment there, you had to be a travel nurse for at least 2 years, and I didn't have that under my belt. If you were to work in their ICU, they wanted you to have at least 4 years of ICU experience, and I didn't qualify for that either. So what ended up happening was all the positions I applied for turned me down, and I ended up taking an assignment out in Los Angeles, California. Now, I kid you not, every single one of the hospitals I applied to in Phoenix ended up calling me within a week of me leaving and arriving in LA and saying, hey, we have positions open in our ICU. And by that time, it was too late. I was already gone. I was in LA and I was not turning back. But it goes to show you how much of a drastic difference it was, because the hospitals understood we are going to have to make some exceptions in order to fill these positions. Now, the same thing is happening when it comes to certain specialties. What they are realizing is that nurses should have the flexibility to be able to change their specialty. You're not locked into a specialty. Once you have your degree and your license, you should be able to move around nursing. Now, is there going to be a learning gap? Yes, there is a knowledge gap between certain specialties. But if you are a nurse and if you survive nursing school, you obviously learned this other specialty, you should be able to learn the new specialty. And I think a lot of these hospitals are more willing to take the time to teach or to fill that knowledge gap. And a lot of them are more willing to put the resources into teaching now that they recognize that, hey, we actually need nurses. We actually need nurses. How are we going to fill these positions? So let me help you. If you are interested in making this leap, I'm going to go over some tips and tricks of how you can, number one, find a specialty that's a great fit for you, and number two, get in the door. So the number one tip is to do your research. When you are researching this specialty, the best thing you can do for yourself is look into the specialty. What type of procedures do they do? What type of skills are you going to need? What is the knowledge gap between where you are and where you need to be? Now, granted, you're not going to have a full list of this because you're not going to know what you don't know until you arrive and you start to get the appropriate training. But learn as much as you can and take note on those skills, because it's going to come up in another tip that I have for you in a couple of minutes. But if you have a better understanding of some of those skills, it's going to help you to kind of sell yourself, but it's also going to help you to realize, do I actually want to work in this specialty? And also, is this specialty a good match for me? For the skills that I do have, am I willing to fill this knowledge gap? Meaning, am I willing to learn all that it's going to take? A lot of specialties, you have to learn specific, like machines and special devices. And if you know that you're not willing to put the work in to learn a bunch of different devices, maybe that specialty is not meant for you. So think about that. Also, some specialties, the hours are going to change depending on what type of facility you're in. For example, when I made the switch to working into the PACU, the type of PACU I worked in made a huge difference. If I worked in inpatient PACU, I was gonna have to accept being on call sometimes, because Working in PACU in a hospital requires you to work on call versus working in a PACU in an outpatient facility where I worked. There's still a change in the schedules because I'm no longer working 12-hour shifts like I did in the ICU. Now the facility I worked at had 10-hour shifts. Also, keeping in mind with those 10-hour shifts, we didn't always get to work the entire 10 hours. It really depended on how many surgeries were booked and how many patients we had during that time frame. If we were able to get everyone in and out and there were no more surgeries booked, then that means everyone goes home. So your schedule is going to might change drastically depending on which specialty you're changing to, and your skills that you need might change drastically. So take all of those things into account as you're taking notes on and you're doing your research. Next, if you have friends or even acquaintances that you know work in these specialties, reach out to them. Ask them what are some of the pros and cons of working in these specialties, and find out how they made the transition if they were previously in another specialty. If they've been in this specialty their entire career, ask them how they made the adjustment and how was the learning curve when they first got started. And if there are any tips and tricks that they could teach you so that you can be prepared. Now, job shadowing is also a really great idea if you are able to do that. I think that sometimes when it comes to HIPAA and filling out paperwork and things like that, it might be hard to do this if it's with another hospital. But if you are looking internally and you are looking at a position that is available at the hospital that you currently work at, job shadowing might be a phenomenal opportunity. You can talk to your unit manager or the unit manager of the specialty that you want to go into and ask them if you are able to shadow for a shift. This could be done via floating to that unit. There have been so many units and specialties that I've been exposed to just simply by floating there. And when you're floating to that unit, you may not be able to take patients necessarily, but you may be able to either shadow with one of the nurses where you're working with that nurse intimately for the entire 12, 10, 8-hour shift, or you can work on that unit as a tasker just to kind of see the different things that are going on and lend a helping hand. This is especially helpful if whatever specialty you're going into is not far off from what you're already doing, or let's say, for example, it may be a step down from the specialty you're in. So for example, I work as an ICU nurse, and when I was doing travel nursing, the rule of thumb for the company that I worked for was, depending on what level of specialty you're in, you can always get floated to the unit that is a specialty below you or an acuity level below you. So being an ICU nurse, that meant we were at the highest level of acuity and we could be floated literally anywhere. So during that 12-week assignment, working 6 days a week, I was floated to so many different units, whether it be the med-surg unit, the surgical unit. I worked in the ED several times. We had a CV ICU. Sometimes we actually had CV patients in there. Sometimes it was just higher level ICU acuity. Where else did I work? I think I worked pretty much everywhere, or at least got floated to almost everywhere, except there was one side of the hospital that they had completely shut off from floating, and that was where Babyland, so labor and delivery, mother baby unit, and pediatrics, they did not let us work there. But I have worked in those units in the meantime, like at other assignments. So I have worked L&D before, I have floated to the mother baby unit, I have worked in the NICU before, and although these specialties are completely different, what they are saying to you is that if you have a high level of acuity already under your belt, you have the basic life-saving skills in case anything goes down. And so sometimes they could use your help either in whatever capacity that you're able to do, or at a minimum, you could be a tasker, right? You could go there and do vital signs. You know how to do that. You could be a runner. You can cover people for their breaks as far as answering call lights, or maybe even just answering phones. Little things like that. But just being on that unit sometimes will give you an idea of what happens on that unit, some of the different scenarios and things to think about, as well as getting introduced to some of their equipment. And if you are planning on taking a position on that unit, you can get to know some of the staff. Next, there are a plethora of options when it comes to online learning. There are so many resources that you can tap into, online forums and groups and blogs where you can learn more about that specialty. Now, the reason why I'm harping so hard on figuring out if you actually want to work this specialty and learning more about it is I cannot tell you how many horror stories that I've heard of nurses that are like obsessed with a specialty, whether it's they are a brand new nurse or they are an experienced nurse. They are obsessed with the idea of working in a specialty, and they jump into it and they get there and it's not what they expected and they don't like it. So the more research that you do to prepare yourself mentally and physically is going to help you to know that you're making the best choice for yourself. And it's also going to help you in the long run, because if you do get into that specialty and it is not what you thought or you do not like it, you understand the process of doing the same thing for another specialty, so you can be able to make an easier pivot. This happened with me personally. Prior to the pandemic hitting, I had decided I wanted to be an ED nurse. And I kind of got burnt out with working in the particular ICU that I was in. And I thought to myself that if I was an ED nurse, it's a little bit more fast-paced. And I thought that I would really enjoy it. So I started doing so much research on being an ED nurse. I started to save different resources for myself, and I made like a quick reference book for myself of different things that I felt like I was going to need to know as an ED nurse. And I started to apply for jobs. I didn't really hear back from any of them because literally right after that, the pandemic hit. But I was so excited about it. I really thought that I wanted to jump into ED nursing. And I was like, oh, I got this. I could so be an ED nurse. Well, one thing I will tell you is I found out really quick and in a hurry when I got floated to the ED on my first travel assignment, oh, this is not for me. My very first time in the emergency room working as a nurse, I did not have my own patient load. I was working there like tasking. And what I was essentially doing is helping to bring patients back. And then once they got into the room, the primary nurse was doing like the initial like assessment and all of that stuff. And I was doing other things like drawing cultures and drawing any labs and getting vitals and all of those other things. But let me tell you, that particular night was a whirlwind. We literally had 3 different codes going on at the exact same time. We had 1 code stroke and 2 code blues going on at the same time. You guys, it blew my mind. I was so shook. Although I had the skills to work in the ED as an ICU nurse, I was not prepared for the level of chaos that happens in the emergency room. The ICU is chaos, but it is organized chaos. And in the ED, all things go. So I was not mentally prepared for handling 2 code blues and a code stroke at the exact same time. So yeah, it happens to the best of us, you guys. Sometimes we think that we know what happens in a certain specialty, but it's just not that once you actually get to work there. My next piece of advice is to align your passions with your goals. Sometimes when we are trying to switch specialties or we have a specific specialty in our mind, we become kind of like closed-minded, where we have just an idea of it has to be this particular specialty. For example, if you know that you want to be a PD ICU nurse, maybe that's the only thing that you're thinking about, and maybe there may not be a position that's open that is specifically pediatric ICU in your city or your town where you live. So that makes it a lot harder. Or maybe there is, but there's only 1 unit and there's no jobs available. Well, I often tell people to look at their passion and to figure out their why. Like, why do you specifically want to work in a pediatric ICU? Is it because you want to help sick children? Are you more so geared towards you want to be around a specific demographic? Focus on that and hone in on your why and broaden your search. Maybe there's not a pediatric ICU job available, but maybe there's like a pediatric PACU job available. Or maybe there's a pediatric, like a med surge type of job available. look into that if you are changing specialties, and kind of figure out if there are other options available that you could possibly make that transition to. Sometimes, we take this big leap, like we want to jump all the way to the highest level, and sometimes we might have to take smaller steps in between. But once again, at least if you're able to move and make that transition into pediatrics, you are working with your desired demographic, and maybe that'll be a great introduction to working with kids, where eventually you could work your way up the ladder and find an ICU position available. But if you were to just say, okay, well, I don't want to do it, I'm just going to keep working with adults until that pediatric ICU job is available, it might take a while before there's a position open. So keep your mind open to this different idea. Another concept for you to consider if you are set on working with a specific demographic is, do you want to work inpatient versus outpatient? Like I mentioned earlier, when I wanted to work PACU, there was a huge difference between working PACU inpatient and working in the PACU outpatient. And when I was able to open my horizons of looking at all of the PACU jobs available, it gave me an option. It gave me a lot more options to apply to. So take that into consideration. Maybe you might work, if you're changing to working with adults after working with kids, maybe you might want to work outpatient, or you might want to work a lower level of acuity, or vice versa. If you're working with adults and you want to switch to working with kids, whatever that jump is, if you're not able to make the full leap into the job that you want to go into, kind of broaden your search and your options to see if there are other options that are adjacent or maybe one step below, where it gives you room to progress in that specialty. All right, so now we're going to jump into the meat and potatoes of how you're really going to execute this. Okay, so one of the biggest things that we have as nurses that they can never take away from us are our skills. And if you have skills in any nursing specialty, I guarantee you have a handful of them that you can leverage in your new specialty. Now, your job right now is to sit down and make a long list of all the skills and all the things that you do on a daily basis in the specialty that you're already in. Now, for me, before I even became a nurse, I worked in healthcare, but I worked as a healthcare administrator, and I worked in so many different fields of healthcare in the military. I was able to take that long list of different skills and leverage them into nursing. So what I know for you is, I know that there are skills that you have that you can leverage into your new specialty. Sit down and make a list. If you need a little help, you can even ask ChatGPT, what skills do I need to be a good med-surg nurse, or whatever specialty you're already in, and then do the same for a list of whatever specialty you're going into. I guarantee you there are some connections there of things that you can leverage. And even if they're not a direct correlation, you can say, I have this skill and I'm willing to do the work to leverage it into this skill. That's what I need you to make that list, and I need you to work on that, because that is going to be your selling point for whenever you do apply for this job. Now, when we're talking about skills, there are hard skills and there's actual soft skills. There are our nursing skills that we can leverage, that we can always apply to other jobs. And there are some skills that are going to be very unique to our specialty. But there are also soft skills that are transferable skills that you can always leverage in any field of nursing, or even anywhere in healthcare. And those are skills like communication and teamwork, adaptability, time management, and patient advocacy. All of these are amazing skills that you will be able to use in any specialty that you're going into. If you can show examples and experience of being able to use those skills, that is going to go a long way, no matter what specialty that you are in. Next, while you're thinking about these skills, I want you to start to draft up some case studies or examples of where you use these skills, because I guarantee you when you do your interview, they're going to start asking you questions. Can you tell me about a time when, or share with me a time that, and you are going to have your examples ready to go. You want to focus on the skills that you are going to need for this new job, like critical thinking and leadership. Customer service is always a thing, you guys. When we work in healthcare, it's not a customer service job, but it most definitely is a customer service job. So think about that, because patient satisfaction matters so much to every single hospital. But beyond that, teamwork is a big one. You have to understand that no matter what specialty you're in, you have to be able to work well as a part of a team. So have examples of different times that you use those skills and have those locked and loaded and ready to tell those stories. When you're making a list of your transferable skills, focus on the outcomes that were created from using these skills. Here are 5 positive outcomes that you can include in your storytelling when you are showing your transferable skills. Improved patient outcomes and recovery. This is aiming for delivering high quality care that leads to better patient recovery, fewer complications, and quicker discharges. This also includes monitoring vital signs, administering medications accurately, and advocating for the best treatment plans. Number 2, exceptional patient experiences. Providing patient care that's compassionate, effectively communicating, and emotionally supporting your patients and their loved ones through a hard and difficult time. This helps to build trust and reduces patient anxiety. Enhancing safety and infection control. This is preventing infections, ensuring patient safety by adhering to strict protocols, using proper hand hygiene, double-checking procedures, and medications to minimize errors. Next, collaborative teamwork and communication. Promoting effective teamwork amongst other healthcare professionals, ensuring a cohesive patient care, clearly communicating patient needs, and enhancing coordination between the doctors, therapy, and other support staff to deliver comprehensive care. And last but not least, continuous professional development. Hospitals want to see that you are willing to do the work to improve yourself before they want to invest in you. So nurses should strive to continuously learn and adapt by attending trainings, pursuing certifications, and staying up to date on the newest evidence-based practices. This is going to lead to better clinical judgment, and it's also going to show that you are willing to learn and to adapt to your new environment and your new specialty. And this always has direct positive benefits towards the team and towards patient care and personal career growth. My next tip is to keep your resume and your LinkedIn updated. Now, we're going to start by talking about your resume. When you are applying for these jobs, make sure that your resume is catered to the job that you want, meaning highlight those skills that you have garnered over your years of experience, and you want to make sure that you highlight those. Highlight your charting systems that you've worked in the past and other things like that, making sure that you are showing off the fact that although there is a knowledge gap, that you are ready and willing to fill that gap. Next is your LinkedIn. Now you want to start to engage with this specialty in any way, starting with by adding keywords and different skills to your LinkedIn account that show that your skills are transferable skills. Next, you can join different groups that have to do with that specialty. For example, if you know that you want to get into pediatric nursing, look online for different local pediatric nursing groups or specialty groups that you can be a part of so you can stay up to date on all of the newer things that are happening in that specialty. Next, post about your current educational goals. If you are taking any certifications or additional courses, post those and brag about them on your LinkedIn account. This shows that you are dedicated to education and you're willing to invest in yourself. Last but not least, make sure that you are updating all of your new educational feats on your LinkedIn account. Post any certifications or courses that you've taken, and you can post them in the education section. This is going to be helpful in case any recruiters look at your LinkedIn account. They're able to see all of your accomplishments, all of your current endeavors at a glance as they scroll through your profile. If this video has been helpful for you so far, make sure to subscribe for more nursing content and share this video with a friend. When it comes to our resumes, a lot of us make our resumes and then kind of tuck them away once we get into our job. Now, the longer you stay in a job, the less you're thinking about that resume until it's time for you to apply for another job. The best thing you can do for yourself is to sit down and do check-ins And as you're doing these check-ins with yourself, you could do them once a quarter or every 6 months. I would suggest at least once a quarter, but look at your career, look at different things that you are doing in your current specialty, different skills that you've learned, certifications that you've obtained, and things like that. And make sure that you're updating your resume as you go along. You may not even be thinking about a job at that time, but later on down the road, it's going to help you to brag on yourself. If you are continually adding those things to both your LinkedIn account where you can publicly display them and also to your resume, it's going to make it easier when it is time to start applying, because you're not going to forget about all those extra classes and courses and things that you needed to add. I cannot tell you how shocked I was when I had to sit down and create a cumulative resume for myself. Now, recently I applied to grad school, and when I turned in my application for grad school, we did a cumulative resume that went over our entire career. Now, I served almost 14 years in the military doing healthcare, but when I became a nurse, all of my jobs that I did for nursing, I just used my nursing resume that literally started from when I graduated on. I had never, and I mean never, created a cumulative resume that had everything on it. And let me tell you, it was very eye-opening for me. It affirmed me. It gave me so much like confirmation and reminded me like, no, you really are that girl. Because I had to tap into things that I had completely forgotten that I had accomplished 10 and 15 years ago. And this is what I mean when I say that we have so many transferable skills that we are sleeping on, you guys. When I put my resume together that started from the beginning of my career back in 2005 all the way through 2005 to 2024, that's almost 20 years, you guys. I was pulling out different stats from projects I had managed, and different projects that I had led, and I had completely forgotten of some of the amazing things that I had accomplished. But all of them were transferable. All of the skills were transferable. All of the lessons learned were transferable, and all of them make me who I am today as a healthcare professional. So that being said, I guarantee you guys have skills that you completely forgot about, whether it be from previous jobs before you were a nurse or the job that you're in right now in that particular specialty, that are all going to be transferable, and they're all going to help you to shine. You just have to take the time to piece those things together and put them on display on your brag board, which is your LinkedIn account, or your personal one, which is your resume. By piecing all of these things together, you are creating a big picture of who you are as a future employee, and you're showing off all of the many skills that you have obtained in the past, as well as your education and your willingness to learn. And putting all of those things together is going to help the employer have a better idea of who you are as a nurse and as a healthcare professional, and it's going to give you a leg up when it comes to applying for jobs that are in a different specialty. Next tip is network, network, network. Get out there and talk to people. Now, you would be surprised how many people work to your left and to your right at your current job who have secondary jobs at other hospital facilities, and they may know about upcoming opportunities. A lot of nurses, they have their multiple hustles, you guys, and although they may work full-time at the same hospital as you, they could work PRN, part-time, or per diem at a number of different hospitals. So by communicating with the people that are around you within your radius, you have no idea how many different opportunities can open up for you. When I learned about my first travel assignment and the company that I took the travel assignment for, I learned it by just talking to one of the supervisors at one of the hospitals I worked for. My hospital had like low census at the current time, and I had started floating to some of our sister facilities. And I floated to a facility that was literally 2 exits away from my hospital, and I loved working at that facility. The more I began to float to this unit, the more I got to know the people there, and I learned about different opportunities and jobs that were available. And it was the manager at this job that actually told us about the travel company that we would take our very first travel assignment with. So I would definitely encourage you to network, and not just with nurses. There may be radiology techs, pharmacists, phlebotomists, people who work anywhere in the hospital who know about different opportunities, or who can connect you with people that they know at a different hospital that you're interested in working in. Now, when it comes to networking, don't just narrow it down to the people that are directly around you. You may have to expand your network a little bit wider. Now, you can attend different alumni groups, different nurse meetups, or different nursing events. Sometimes nursing conventions are a great place for you to meet new people, whether it be people who work at different hospitals in your local town, or if you are looking to move to a different city, this would be an awesome opportunity for you to meet nurses that work in a different city as well. And last but definitely not least, when it comes to opening your horizons and meeting new people, mentors are phenomenal for this. Now, if you're able to get a mentor when it comes to nursing, you're going to find that that mentor is going to be able to open so many doors of opportunity for you by just connecting you to their network. If you have a mentor already, talk to your mentor about this change that you're trying to make, and ask him or her if they have any advice for you or anyone that they could possibly introduce you to. A lot of times when we work in higher levels of healthcare, or you work in management or things like that, you learn about different opportunities because you have different friends that work in similar positions at other hospitals. And if your manager happens to know the manager at the hospital that you're interested in moving to, that would be a perfect door of opportunity that might open for you. But you never know if you don't ask. So get out there, ask your mentor, sit down with your mentor, and just talk to them about the changes that you're thinking about making. They may have some advice for you that I didn't include in this video that might be good advice for helping you with your transition to practice in your new specialty, as well as being able to connect you to their professional community and circle. If you don't currently have a mentor, now would be a great time for you to obtain one. You could look online for different mentor groups or different specialties. You could possibly look for a mentor in the specialty you're interested in going into, or you can start where you're at, or looking in local nursing organizations. But having a mentor is literally like the cheat code when it comes to progressing in your career, because they are going to be able to help you by not making the mistakes that maybe they made on their way up the ladder of success, or by offering you different resources that are available. Mentors are so helpful when it comes to things like this, and having a mentor will definitely help you to make your transition to practice into your new specialty a lot smoother. Now, my very last piece of advice might be a tiny bit controversial, so hang on, but my advice is just apply. Now, there are so many jobs out there, and if we read the job description, you might think to yourself, oh my gosh, I don't qualify for this job. I don't have 4 years of ICU experience or 3 years of PACU experience. My advice is to just apply. There are so many different times where people or jobs are willing to make an exception for a candidate because they check every other box, and they are willing to look past that 1 or 2 things that you did not qualify for because they feel like you would match the job itself. And now this can happen for applying for a job in person. This can happen for stumbling upon different opportunities, like maybe you meet a recruiter who was like, oh wow, you'd be a great fit for this job, or from your network that you are expanding through a mentor or a friend. Sometimes you don't meet all of the job description qualifications on paper, but you might be the best candidate because you're willing to learn, because you're a hard worker, because you are have experience in leadership or management, because you have teamwork capability. Whatever it is that they are looking for. Sometimes jobs will hire previous candidates based off of using their said checklist of requirements and find out, okay, although this person met all of these qualifications, they just weren't a good fit with our team. So their hiring process from that point forward could have more to do with your personality and your ability to work with a team and to get along with that team, especially if this is a unit that's very small and tight-knit. So if you are looking at a job and you're thinking to yourself, man, this is impossible, I'll never be able to get this job, I don't meet the qualifications, just apply anyways. I'm going to tell you what I tell a lot of people. The worst thing they can tell you is no. So apply for the job anyways and continue to go after it. If you get to the interview process and you don't get the job, I would ask you to like follow up with them. Ask the questions. What qualifications how can I better prepare next time so that I am ready to accept the job the next time it's available? Ask them if there's any internship or shadowing possibilities for you. Sometimes once they see your hunger for the specialty and for the job, they may make those exceptions for you, or they see your personality and they see that you really are interested in doing this specialty and this job. They will make exceptions for you, I guarantee. There are so many people that have gotten in the door with this method of just applying, and a lot of times they may not be able to find candidates that meet all of their requirements, but you fit the most important qualifications for that job. So you are the best candidate. So never count yourself out. At least at a minimum, just apply. And if the answer is no, be inquisitive and ask why so you can figure out what you can do better for next time. Thank you guys so much for watching. I hope you enjoyed this video and I hope this was insightful for you. I hope that you're able to take these tips and these tricks, create a plan for yourself, and go apply and get that job that you are hoping for. If you are interested in changing specialties, comment down below. Let me know what specialty you're in and what specialty you're thinking about applying to. I would love to learn more about it. Thanks again for watching, you guys. Don't forget to subscribe, like the video, and share it with a friend. And I will see you guys in the next video.